Hydroxyprogesterone caproate injection is a man-made progestin hormone. It is used in pregnant women to help lower the risk of giving birth too early, preterm birth or giving birth less than 37 weeks of pregnancy. This medicine is given only to pregnant women who are pregnant with one baby and who have had a preterm delivery of one baby in the past. This medicine is to be administered only by or under the immediate supervision of your doctor. Before using. In deciding to use a medicine, the risks of taking the medicine must be weighed against the good it will do. This is a decision you and your doctor will make. For this medicine, the following should be considered. Allergies. Tell your doctor if you have ever had any unusual or allergic reaction to this medicine or any other medicines. Also tell your healthcare professional if you have any other types of allergies, such as to foods, dyes, preservatives, or animals. For non-prescription products, read the label or package ingredients carefully. Pediatric. Hydroxyprogesterone caproate injection is not indicated for children younger than 16 years of age. Safety and efficacy have not been established. Geriatric. No information is available on the relationship of age to the effects of hydroxyprogesterone caproate injection in geriatric patients. This medicine should not be used in elderly women. Breastfeeding. Studies in women suggest that this medication poses minimal risk to the infant when used during breastfeeding. Drug interactions. Although certain medicines should not be used together at all, in other cases two different medicines may be used together even if an interaction might occur. In these cases, your doctor may want to change the dose, or other precautions may be necessary. Tell your healthcare professional if you are taking any other prescription or non-prescription, over-the-counter, OTC, medicine. Other interactions. Certain medicines should not be used at or around the time of eating food or eating certain types of food since interactions may occur. Using alcohol or tobacco with certain medicines may also cause interactions to occur. Discuss with your healthcare professional the use of your medicine with food, alcohol, or tobacco. Other medical problems. The presence of other medical problems may affect the use of this medicine. Make sure you tell your doctor if you have any other medical problems, especially abnormal or unusual vaginal bleeding or blood clots or history of or breast cancer, active or history of or cholestasis, bowel problem, during pregnancy or hypertension, high blood pressure, uncontrolled or liver disease, including tumors or cancer, should not be used in patients with these conditions. Asthma or depression, history of or diabetes or family history of or epilepsy or seizures, history of or fluid retention, swelling or edema, or heart problems or hypertension, high blood pressure, controlled or kidney problems or migraine headaches or preeclampsia, high blood pressure during pregnancy and too much protein in urine. Patients with these conditions should be carefully monitored while receiving this medicine. Proper use. A doctor or other trained health professional will give you this medicine in a hospital or clinic. This medicine is given as a shot into one of your muscles, usually in the hip area, upper outer area of the buttocks. It may also be given as a shot under your skin in the back of your upper arm. This medicine is given once a week, every 7 days. You will begin receiving this medicine between 16 weeks and 0 days of your pregnancy, and 20 weeks and 6 days of your pregnancy. You will continue to receive this medicine once a week until week 37, through 36 weeks, 6 days of your pregnancy, or until you give birth. It is very important that you do not miss a dose and that you continue to receive this medicine weekly. If you miss a dose, call your doctor. This medicine comes with a patient information leaflet. Read and follow the instructions carefully. Ask your doctor if you have any questions. Precautions. It is very important that you return to your doctor's office for your weekly shots. This will allow your doctor to see if the medicine is working properly and to decide if you should continue to receive it. Blood tests may be needed to check for unwanted effects. Check with your doctor right away if you have pain in the chest, groin, or legs, especially the calves, difficulty with breathing, a sudden, severe headache, slurred speech, a sudden loss of coordination or vision changes while receiving this medicine. This medicine may cause serious allergic reactions, including angioedema. Check with your doctor right away if you have a rash, itching, or large, hive-like swelling on the face, eyelids, lips, tongue, throat, hands, legs, feet, or sex organs after you receive the medicine. This medicine may cause pain, soreness, itching, swelling, or bruising. Call your doctor right away if you have increased pain or discomfort, oozing of blood or fluid, or swelling at the injection site. This medicine may affect blood sugar levels. If you notice a change in the results of your blood or urine sugar tests, or if you have any questions, check with your doctor. Check with your doctor right away if you have pain or tenderness in the upper stomach, pale stools, dark urine, loss of appetite, nausea, unusual tiredness or weakness, or yellow eyes or skin. These could be symptoms of a serious liver problem. Do not take other medicines unless they have been discussed with your doctor. This includes prescription or non-prescription, over-the-counter, OTC, medicines and herbal or vitamin supplements. Side effects. Along with its needed effects, a medicine may cause some unwanted effects. Although not all of these side effects may occur, if they do occur, they may need medical attention. Check with your doctor or nurse immediately if any of the following side effects occur. More common: pain, itching, or swelling at the injection site. Less common: small lumps at the injection site. Incidence not known: anxiety, chest pain, cough, dizziness or lightheadedness, fainting, fast heartbeat, redness, tenderness, or warmth on the skin, troubled breathing. Some side effects may occur that usually do not need medical attention. These side effects may go away during treatment as your body adjusts to the medicine. Also, your healthcare professional may be able to tell you about ways to prevent or reduce some of these side effects. Check with your healthcare professional if any of the following side effects continue or are bothersome, or if you have any questions about them. More common: hives or welts, itching, skin rash, nausea. Less common: diarrhea. Other side effects not listed may also occur in some patients. If you notice any other effects, check with your healthcare professional. Call your doctor for medical advice about side effects. You may report side effects to the FDA. Methergine, methylergonavine, is an ergot alkaloid that affects the smooth muscle of a woman's uterus, improving the muscle tone as well as the strength and timing of uterine contractions. Methergine is administered in the postpartum period to help deliver the placenta and to help control bleeding and other uterine problems after childbirth. What are side effects of methergine? Side effects of methergine include nausea, vomiting, stomach pain, diarrhea, leg cramps, increased sweating, skin rash, headache, dizziness, ringing in your ears, stuffy nose, or unpleasant taste in your mouth. Seek medical care or call 911 at once if you have the following serious side effects. Serious eye symptoms such as sudden vision loss, blurred vision, tunnel vision, eye pain or swelling, or seeing halos around lights. Serious heart symptoms such as fast, irregular, or pounding heartbeats, fluttering in your chest, shortness of breath, and sudden dizziness, lightheadedness, or passing out. Severe headache, confusion, slurred speech, arm or leg weakness, trouble walking, loss of coordination, feeling unsteady, very stiff muscles, high fever, profuse sweating, or tremors. This document does not contain all possible side effects and others may occur. Check with your physician for additional information about side effects. Dosage for methergine. Methergine can be given in tablet form, as an intramuscular injection, or intravenously. The intramuscular dose of methergine is 1 ml, 0.2 mg, after delivery of the anterior shoulder, after delivery of the placenta, or during the puerperium. The intravenous dose of methergine is 1 ml, 0.2 mg, administered slowly over a period of no less than 60 seconds. The oral dose of methergine is 1 tablet, 0.2 mg, 3 or 4 times daily in the puerperium for a maximum of 1 week. What drugs, substances, or supplements interact with methergine? Methergine may interact with conivaptan, epinephrine, imatinib, isoniazid, nefazodone, Xylitol, antibiotics, antidepressants, antifungals, cold or allergy medicines that contain decongestants, heart or blood pressure medications, hepatitis C medications, HIV/AIDS medications, migraine headache medicines, nitrates, or other ergot medicines. Tell your doctor all medications and supplements you use. Do not use methergine during pregnancy. Methergine is to be used only after delivery of baby. Do not breastfeed within 12 hours after taking methergine. Methergine during pregnancy and breastfeeding. Methylergonavine may pass into breast milk in small amounts and could affect a nursing baby. In some cases this drug may be used for up to 1 week after a baby is born. It is important to discuss with your doctor about whether you should breastfeed during that time. Additional information. Our Methergyne Side Effects Drug Center provides a comprehensive view of available drug information on the potential side effects when taking this medication. Methergyne registered, methylergonavine maleate, is a semi-synthetic ergot alkaloid used for the prevention and control of postpartum hemorrhage. Methergyne is available in tablets for oral ingestion containing 0.2 mg methylergonavine maleate. Tablets. Active ingredient, methylergonavine maleate, USP, 0.2 mg. Inactive ingredients, acacia, cornstarch, gelatin, lactose monohydrate, methylparaben, microcrystalline cellulose, povidone, propylparaben, stearic acid, and tartaric acid. Chemically, methylergonavine maleate is designated as ergoline 8-carboxamide, 9,10-dihydro-N, 1-hydroxymethyl, propyl-6-methyl-8-beta, S-Z-2-butadiene, 1:1, salt. Its structural formula is Methergyne registered, methylergonavine maleate, formula illustration. Indications and dosage. Indications. Following delivery of placenta, for routine management of uterine atony, hemorrhage and subinvolution of the uterus. For control of uterine hemorrhage in the second stage of labor following delivery of the anterior shoulder. Dosage and administration. Parenteral drug products should be inspected visually for particulate matter and discoloration prior to administration. Intramuscularly. 1 ml, 0.2 mg, after delivery of the anterior shoulder, after delivery of the placenta, or during the puerperium. May be repeated as required, at intervals of 2 to 4 hours. Intravenously. 1 ml, 0.2 mg, administered slowly over a period of no less than 60 seconds, see warnings. Orally. 1 tablet, 0.2 mg, 3 or 4 times daily in the puerperium for a maximum of 1 week. How supplied? White, round, biconvex compressed tablets debossed with N on one side and 0.1 on the other side. Available in bottles of 7, 12, 28 and 100 tablets. Bottles of 7. NDC 27437-050-19. Bottles of 12. NDC 27437-050-57. Bottles of 28. NDC 27437-050-56. Bottles of 100. NDC 27437-050-01. Store and dispense. Tablets, store below 25 degrees Celsius 77 degrees Fahrenheit, in tight, light-resistant container. The most common adverse reaction is hypertension associated in several cases with seizure and/or headache. Hypotension has also been reported. Abdominal pain, caused by uterine contractions, nausea and vomiting have occurred occasionally. Rarely observed reactions have included acute myocardial infarction, transient chest pains, vasoconstriction, vasospasm, coronary arterial spasm, bradycardia, tachycardia, dyspnea, hematuria, thrombophlebitis, water intoxication, hallucinations, leg cramps, dizziness, tinnitus, nasal congestion, diarrhea, diaphoresis, palpitation, rash, and foul taste. 1. There have been rare isolated reports of anaphylaxis, without a proven causal relationship to the drug product. Post-marketing experience. The following adverse drug reactions have been derived from post-marketing experience with Methergyne via spontaneous case reports. Because these reactions are reported voluntarily from a population of uncertain size, it is not possible to reliably estimate their frequency, which is therefore categorized as not known. Nervous system disorders. Cerebrovascular accident, paresthesia. Cardiac disorders. Ventricular fibrillation, ventricular tachycardia, angina pectoris, atrioventricular block. Drug interactions. Drug interactions. CYP3A4 inhibitors, example macrolide antibiotics and protease inhibitors. There have been rare reports of serious adverse events in connection with the co-administration of certain ergot alkaloid drugs, example dihydroergotamine and ergotamine, and potent CYP3A4 inhibitors, resulting in vasospasm leading to cerebral ischemia and or ischemia of the extremities. Although there have been no reports of such interactions with methylergonavine alone, potent CYP3A4 inhibitors should not be co-administered with methylergonavine. Examples of some of the more potent CYP3A4 inhibitors include macrolide antibiotics, example erythromycin, troleandomycin, clarithromycin, HIV protease or reverse transcriptase inhibitors, example, ritonavir, indinavir, nelfinavir, delaverdine, or azole antifungals, example, ketoconazole, itraconazole, voriconazole. Less potent CYP3A4 inhibitors should be administered with caution. Less potent inhibitors include saquinavir, nefazodone, fluconazole, grapefruit juice, fluoxetine, fluvoxamine, xylitol, and clotrimazole. These lists are not exhaustive, and the prescriber should consider the effects on CYP3A4 of other agents being considered for concomitant use with methylorgonavine. CYP3A4 inducers. Drugs, e.g. nevirapine, rifampicin, that are strong inducers of CYP3A4 are likely to decrease the pharmacological action of methergine. Beta blockers. Caution should be exercised when methergine is used concurrently with beta blockers. Concomitant administration with beta blockers may enhance the vasoconstrictive action of ergot alkaloids. Anesthetics. Anesthetics like Halothane and methoxyfluorine may reduce the oxytocic potency of methergine. Glyceryl trinitrate and other antianginal drugs. Methylorgonavine maleate produces vasoconstriction and can be expected to reduce the effect of glyceryl trinitrate and other antianginal drugs. No pharmacokinetic interactions involving other cytochrome P450 isoenzymes are known. Caution should be exercised when methergine, methylorgonavine maleate, is used concurrently with other vasoconstrictors, ergot alkaloids, or prostaglandins. Drug abuse and dependence. Methergine, methylorgonavine maleate, has not been associated with drug abuse or dependence of either a physical or psychological nature. General. This drug should not be administered IV routinely because of the possibility of inducing sudden hypertensive and cerebrovascular accidents. If IV administration is considered essential as a life-saving measure, methergine, methylorgonavine maleate, should be given slowly over a period of no less than 60 seconds with careful monitoring of blood pressure. Intraarterial or periarterial injection should be strictly avoided. Caution should be exercised in presence of impaired hepatic or renal function. Breastfeeding. Mothers should not breastfeed during treatment with methergine. Milk secreted during this period should be discarded. Methergine may produce adverse effects in the breastfeeding infant. Methergine may also reduce the yield of breast milk. Mothers should wait at least 12 hours after administration of the last dose of methergine before initiating or resuming breastfeeding. Coronary artery disease. Patients with coronary artery disease or risk factors for coronary artery disease, example, smoking, obesity, diabetes, high cholesterol, may be more susceptible to developing myocardial ischemia and infarction associated with methylorgonavine-induced vasospasm. Medication errors. Inadvertent administration of methergine to newborn infants has been reported. In these cases of inadvertent neonatal exposure, symptoms such as respiratory depression, convulsions, cyanosis, and oliguria have been reported. Usual treatment is symptomatic. However, in severe cases, respiratory and cardiovascular support is required. Methergine has been administered instead of vitamin K and hepatitis B vaccine, medications which are routinely administered to the newborn. Due to the potential for accidental neonatal exposure, methergine injection should be stored separately from medications intended for neonatal administration. Precautions. Precautions. General. Caution should be exercised in the presence of sepsis, obliterative vascular disease. Also use with caution during the second stage of labor. The necessity for manual removal of a retained placenta should occur only rarely with proper technique and adequate allowance of time for its spontaneous separation. Carcinogenesis, mutagenesis, impairment of fertility. No long-term studies have been performed in animals to evaluate carcinogenic potential. The effect of the drug on mutagenesis or fertility has not been determined. Pregnancy. Category C, animal reproductive studies have not been conducted with methergine. It is also not known whether methylorgonavine maleate can cause fetal harm or can affect reproductive capacity. Use of methergine is contraindicated during pregnancy because of its uterotonic effects. See indications and usage. Labor and delivery. The uterotonic effect of methergine is utilized after delivery to assist involution and decrease hemorrhage, shortening the third stage of labor. Nursing mothers. Mothers should not breastfeed during treatment with methergine and at least 12 hours after administration of the last dose. Milk secreted during this period should be discarded. Pediatric use. Safety and effectiveness in pediatric patients have not been established. Geriatric use. Clinical studies of methergine did not include sufficient number of subjects aged 65 and over to determine whether they respond differently from younger subjects. Other reported clinical experience has not identified differences in response between the elderly and younger patients. In general, dose selection for an elderly patient should be cautious, usually starting at the low end of the dosing range, reflecting the greater frequency of decreased hepatic, renal, or cardiac function, and of concomitant disease or other drug therapy. Symptoms of acute overdose may include nausea, vomiting, oliguria, abdominal pain, numbness, tingling of the extremities, rise in blood pressure, in severe cases followed by hypotension, respiratory depression, hypothermia, convulsions, and coma. Because reports of overdosage with methergine, methylergonavine maleate, are infrequent, the lethal dose in humans has not been established. The oral LD50, in mg/kg, for the mouse is 187, the rat 93, and the rabbit 4.52. Several cases of accidental methergine injection in newborn infants have been reported, and in such cases 0.2 mg represents an overdose of great magnitude. However, recovery occurred in all but one case following a period of respiratory depression, hypothermia, hypertonicity with jerking movements, and convulsions. Also, several children 1 to 3 years of age have accidentally ingested up to 10 tablets, 2 mg, with no apparent ill effects. A postpartum patient took 4 tablets at one time in error and reported paresthesias and clamminess as her only symptoms. Treatment of acute overdosage is symptomatic and includes the usual procedures of removal of offending drug by inducing emesis, gastric lavage, catharsis, and supportive diuresis. Maintenance of adequate pulmonary ventilation, especially if convulsions or coma develop. Correction of hypotension with pressor drugs as needed. Control of convulsions with standard anticonvulsant agents. Control of peripheral vasospasm with warmth to the extremities if needed. Contraindications: hypertension, toxemia, pregnancy, and hypersensitivity. Clinical pharmacology. Clinical pharmacology. Methergine, methylergonavine maleate, acts directly on the smooth muscle of the uterus and increases the tone, rate, and amplitude of rhythmic contractions. Thus, it induces a rapid and sustained titanic uterotonic effect which shortens the third stage of labor and reduces blood loss. The onset of action after IV administration is immediate, after IM administration, 2 to 5 minutes, and after oral administration, 5 to 10 minutes. Pharmacokinetic studies following an IV injection have shown that methylergonavine is rapidly distributed from plasma to peripheral tissues within 2 to 3 minutes or less. The bioavailability after oral administration was reported to be about 60% with no accumulation after repeated doses. During delivery, with intramuscular injection, bioavailability increased to 78%. Ergot alkaloids are mostly eliminated by hepatic metabolism and excretion, and the decrease in bioavailability following oral administration is probably a result of first-pass metabolism in the liver. Bioavailability studies conducted in fasting healthy female volunteers have shown that oral absorption of a 0.2 mg methylergonavine tablet was fairly rapid with a mean peak plasma concentration of 3,243 plus or minus 1308 pg/ml observed at 1.12 plus or minus 0.82 hours. For a 0.2 mg intramuscular injection, a mean peak plasma concentration of 5,918 plus or minus 1952 pg/ml was observed at 0.41 plus or minus 0.21 hours. The extent of absorption of the tablet, based upon methylergonavine plasma concentrations, was found to be equivalent to that of the IM solution given orally, and the extent of oral absorption of the IM solution was proportional to the dose following administration of 0.1, 0.2, and 0.4 mg. When given intramuscularly, the extent of absorption of methergine solution was about 25% greater than the tablet. The volume of distribution, VDSS/F, of methylergonavine was calculated to be 56.1 plus or minus 17.0 liters, and the plasma clearance, CLP/F, was calculated to be 14.4 plus or minus 4.5 liters per hour. The plasma level decline was biphasic with a mean elimination half-life of 3.39 hours, range 1.5 to 12.7 hours. A delayed gastrointestinal absorption, Tmax about 3 hours, of methergine tablet might be observed in postpartum women during continuous treatment with this oxytocic agent. Mifepristone, also known as Ru-486, is used to end a pregnancy during the early part of a pregnancy. It is used up to week 10 of pregnancy, up to 70 days after the first day of your last menstrual period. Mifepristone blocks a natural substance, progesterone, that is needed for your pregnancy to continue. It is usually used together with another medicine called misoprostol. Mifepristone must not be used if you have a rare abnormal pregnancy that is outside the womb, ectopic pregnancy. It will not end the pregnancy in this case. It may cause an ectopic pregnancy to rupture, resulting in very serious bleeding. How to use mifepristone oral. Read the medication guide provided by your doctor before you start using mifepristone. Keep the guide to reread if needed. Read and sign the patient agreement form provided by your doctor. If you have any questions, consult your doctor or pharmacist. You must visit the doctor's office at least 2 times to complete your treatment and important examinations. This treatment is only given under direct medical supervision. Learn about who to call and what to do in case of an emergency. Your doctor may order an ultrasound to make sure your pregnancy is less than 10 weeks and is not outside the womb, ectopic. Take mifepristone by mouth as directed by your doctor, usually as a single dose. After taking mifepristone, your doctor should direct you to wait 24 to 48 hours before taking another medication, misoprostol, by mouth as a single dose. The medications may not work well if you take misoprostol sooner than 24 hours after taking mifepristone or later than 48 hours after taking mifepristone. Follow your doctor's instructions carefully. Heavy vaginal bleeding does not mean that the pregnancy has ended. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says you may do so safely. Grapefruit can increase the chance of side effects with this medicine. Ask your doctor or pharmacist for more details. It is important that you return for a follow-up visit within 7 to 14 days after taking mifepristone, even if you are not having any problems. If the pregnancy has not ended, or there are serious medical problems, surgery may be needed. If the treatment fails and the pregnancy continues until birth, there is a risk of birth defects. Severe bee sting allergies can turn a picnic in the park into a nightmare. In fact, it only takes a few minutes to experience intense swelling and even cardiac arrest. No wonder people with bee sting allergies are often anxious outdoors. By following these 3 steps, you can learn how to better prevent bee sting allergic reactions while also feeling safer than before. Number 1. Discover your proactive treatment option. After discovering a severe allergy, most people are prescribed an epinephrine pen. While these pens are incredibly effective at stopping an allergic reaction, they do not prevent them. Instead, it becomes very important that allergy patients always carry their pens and know how to use them under extreme pressure. This type of treatment is reactive. It does not significantly reduce the risk of a reaction or decrease anxiety. Bee sting allergy patients are left to fend for themselves. Venom immunotherapy is a proactive treatment. It prevents a bee sting allergic reaction before stepping foot outside. How? An allergist administers tiny doses of venom under the skin. Over time, the dose is increased, and so is the body's immunity to bee stings. Once the ideal dosage is reached, the patient is up to 98% protected. 1. A walk in the park can actually be easy. Are you protected? Number 2. Find a local allergist. The next step to preventing bee sting allergic reactions is to find a local allergist. These specialists can help you determine if venom immunotherapy is right for you. Use the locator below to discover a provider near you. Important. WebMD and Be Aware Allergy respect your privacy choices. By completing the form below, you will transfer your information to Be Aware Allergy and its designated parties in order to fulfill your request. Be Aware Allergy and its designated parties will use your information as outlined in the Be Aware Allergy privacy policy. Entry of the below information indicates your agreement with the terms of use. Number 3. Get tested and treated for bee sting allergies. If you suspect you have an allergy, but haven't been tested, now is the time. Allergists can determine your risk for a severe reaction through skin testing. First, the skin on your forearm is lightly pricked. Then, a drop of highly diluted venom is applied. Depending on your reaction or non-reaction, the allergist may inject microdoses of venom under the skin. A small, red welt will likely indicate an allergy, and the size of the welt reveals how severe the allergy is. Next, discuss treatments with your allergist. Venom immunotherapy is a great option for peace of mind. In fact, if it is right for you, your allergist can rush your treatment. By quickly reaching the ideal dosage over a few hours or days, you can experience up to 98% protection now, during the warmer months. Point 2. You deserve to enjoy your summer. Find an allergist. Rush venom immunotherapy still requires patients to continue receiving regularly scheduled maintenance doses. While this treatment requires a commitment, the safety it offers is incredible. Talk to an allergist today to prevent an emergency tomorrow. Learn more at beawareallergy.com. References: Goldberg, A., and Confino Cohen, R., 2000. Insect sting-inflicted systemic reactions, attitudes of patients with insect venom allergy regarding after-sting behavior and proper administration of epinephrine. Journal of Allergy and Clinical Immunology, 106, 6, 1184-1189. doi, 10.1067/my.2000.110927. Golden, D. B., 2007. Insect Sting Anaphylaxis. Immunology and Allergy Clinics of North America, 27, 2, 261-272. doi, 10.1016/j.iac.2007.03.008. Why is this medication prescribed? Dinoprostone is used to prepare the cervix for the induction of labor in pregnant women who are at or near term. This medication is sometimes prescribed for other uses. Ask your doctor or pharmacist for more information. How should this medicine be used? Dinoprostone comes as a vaginal insert and as a gel that is inserted high into the vagina. It is administered using a syringe, by a health professional in a hospital or clinic setting. After the dose has been administered, you should remain lying down for up to 2 hours as directed by your physician. A second dose of the gel may be administered in 6 hours if the first dose does not produce the desired response. What special precautions should I follow before taking dinoprostone? Tell your doctor and pharmacist if you are allergic to dinoprostone or any other drugs. Tell your doctor and pharmacist what prescription and non-prescription medications you are taking, including vitamins. Tell your doctor if you have or have ever had asthma, anemia, a cesarean section or any other uterine surgery, diabetes, high or low blood pressure, placenta previa, a seizure disorder, 6 or more previous term pregnancies, glaucoma or increased pressure in the eye, cephalopelvic disproportion, previous difficult or traumatic deliveries, unexplained vaginal bleeding, or heart, liver, or kidney disease. What side effects can this medication cause? Side effects from dinoprostone are not common, but they can occur. Tell your doctor if any of these symptoms are severe or do not go away. Upset stomach, vomiting, diarrhea, dizziness, flushing of the skin, headache, fever. If you experience any of the following symptoms, call your doctor immediately. Unpleasant vaginal discharge, continued fever, chills and shivering, increase in vaginal bleeding several days after treatment, chest pain or tightness, skin rash, hives, difficulty breathing, unusual swelling of the face. If you experience a serious side effect, you or your doctor may send a report to the Food and Drug Administration's, FDA, MedWatch Adverse Event Reporting Program online, http://www.fda.gov/safety/medwatch, or by phone 1-800-332-1088. What should I know about storage and disposal of this medication? Dinoprostone gel should be stored in a refrigerator. The inserts should be stored in a freezer. Keep this medication in the container it came in, tightly closed, and out of reach of children. What other information should I know? Keep all appointments with your doctor. Do not let anyone else use your medication. It is important for you to keep a written list of all of the prescription and non-prescription, over-the-counter, medicines you are taking, as well as any products such as vitamins, minerals, or other dietary supplements. You should bring this list with you each time you visit a doctor or if you are admitted to a hospital. It is also important information to carry with you in case of emergencies. Indication: expand, collapse. Cervidil registered, dinoprostone, 10 mg, is a vaginal insert approved to start and or continue the ripening of the cervix in pregnant women who are at or near the time of delivery and in whom there is a medical reason for inducing, bringing on, labor. For the first 2 hours following insertion, you should remain lying down. If you sit up or walk after the first 2 hours, you should be careful to ensure the insert remains in place. While Cervidil is inserted, your doctor will carefully monitor your progress and your baby's well-being and will determine when the insert should be removed. Important safety information about Cervidil. Cervidil should only be inserted by a trained healthcare professional in a hospital setting appropriate for childbirth. Who should not be given Cervidil? You should not be given Cervidil if you have experienced an allergic reaction to prostaglandins, certain hormone-like substances, experienced unexplained vaginal bleeding during your pregnancy, already started receiving drugs to induce labor, given birth 6 or more times in your lifetime. You should also not be given Cervidil if your doctor has determined that your baby is in distress and needs to be delivered urgently. Your baby may be too large to fit through your birth canal, cephalopelvic disproportion. Drugs used to induce labor are not appropriate for you, or that prolonged contraction of your uterus may be harmful to you or your baby, such as if you have had a previous cesarean section or major surgery on your uterus. What are the most serious risks associated with the use of Cervidil? The induction of labor has been associated with an increased risk of a disorder of abnormal clotting of the blood that results in excessive bleeding immediately after birth, disseminated intravascular coagulation or DIC. The risk is higher in women over age 30, those with complications during pregnancy, and those whose pregnancy has lasted longer than 40 weeks. In rare cases, the use of Cervidil has been associated with an increased risk of a life-threatening event to the mother called amniotic fluid embolism. The cause of amniotic fluid embolism is not well understood, but it is believed that some amniotic fluid or other substances can get into your bloodstream and start a severe reaction that can cause heart and lung collapse. What should I discuss with my doctor before labor induction begins or Cervidil is given? As you would throughout your pregnancy, be sure to tell your doctor about all prescription or over-the-counter medications you are taking. Before Cervidil is given, be sure you have told your doctor about all your current and past medical conditions, including if your water has broken, any unexplained vaginal bleeding during pregnancy, all uterine surgeries, especially previous cesarean section, a history of contractions lasting more than 2 minutes, glaucoma, asthma, even if you had childhood asthma and have had no asthma attacks as an adult. What are the most common side effects of Cervidil? The most common side effects associated with the administration of Cervidil are contractions occurring at a rate faster than normal, tachysystole, and signs that the baby is exhausted or in distress, uterine hyperstimulation. In clinical trials, these effects occurred alone or together in less than 1 in 20 women who were given Cervidil. In clinical trials, fever, nausea, vomiting, diarrhea and abdominal pain were noted in less than 1 in 100 women who were given Cervidil. This is not a complete list of possible side effects. If you experience an adverse event, please discuss it with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. People depicted in images are models. Images used for illustrative purposes. Please see full prescribing information. References: 1. Cervidil, package insert. Parsippany, New Jersey, Ferring Pharmaceuticals Incorporated. 2. 2018 FDA Orange Book. https://www.accessdata.fda.gov/script/cder/ob/default.cfm. Accessed August 17, 2015. 3. The American College of Obstetricians and Gynecologists. Frequently asked questions, labor, delivery, and postpartum care. http://www.acog.org/patient/faqs/labor-induction. Published 2017. Accessed. This medication is used to help prepare your cervix, the lower opening of the womb, for labor and delivery. It is used by women who are having a normal pregnancy and who are at or near their delivery due date. Dinoprostone is a natural substance that your body makes in preparation for labor. It relaxes and softens your cervix, cervical ripening, to allow the baby to pass through the birth canal during delivery. How to use Prepidil 0.5 mg per 3g vaginal gel abortifacients. This drug is inserted high in your vagina next to the cervix by a healthcare professional. You will be lying on your back with your knees bent outward while the medication is placed, and you will usually need to continue lying down for at least 15 to 30 minutes to prevent the gel from leaking out. The healthcare professional will tell you when you can get up and walk around. This medication should only be used in a hospital setting with trained medical care available. You will be monitored for changes in your cervix, for signs of active labor, such as water breaking, strong sustained contractions, and for your baby's condition. If you do not have signs of active labor after 6 hours, your doctor may give you another dose. The dosage is based on your medical condition and response to treatment. Over-the-counter drugs and chicken soup help both, right? Not so fast. It's important to learn which kind of illness you're dealing with. That's because the flu can have serious complications, like the lung infection pneumonia. It can even be deadly. Flu treatments work best within 48 hours of the time symptoms start. Prescription antiviral drugs may cut the time you're sick. Flu comes on fast and furious. February 15th. If you feel like you've been hit by a truck, it's probably the flu. Symptoms like sore throat, fever, headache, muscle aches, congestion, and cough tend to come on suddenly. Colds are usually less intense and include a runny or stuffy nose. The flu gets better over 2 to 5 days, but you might feel run down for a week or longer. Colds come on slowly and last up to 10 days. Fever usually means flu. Fever usually means flu. March 15th. While some people may get a slight fever when they have a cold, most don't. If you have the flu, you'll probably run a temperature of 100 to 104 F. Children's flu fevers tend to be higher. Kids may also be more likely to have a fever with the common cold. Flu fatigue can last for weeks. Flu fatigue can last for weeks. April 15th. You likely start off feeling extremely tired and achy all over. That fatigue and weakness may last for up to 3 weeks or even longer in seniors and people with long-term, chronic diseases or a weak immune system. With a cold, you usually feel bad for just a few days. Colds and flu both can cause headaches. Colds and flu both can cause headaches. May 15th. Still, a headache that comes along with a cold, like other symptoms that result from the virus, tends to be milder than one caused by flu. Related. Coughs, sign of both colds and flu. Coughs, sign of both colds and flu. June 15th. Colds and flu are respiratory illnesses, which affect your airways, so both can cause coughing. Pneumonia is a lung infection that can be a complication of the flu. Call your doctor if you have a persistent cough, fever higher than 102 F and chills, a hard time breathing, shortness of breath, or chest pain when you cough. Earaches can come from colds or flu. July 15th. Congestion from either ailment can make your ear pressure rise. This affects the eustachian tube, which connects your throat to your middle ear. It can cause a dull ear pain, hearing loss, and the sensation of popping in your ears. It usually goes away with your other symptoms. See your doctor if the earache lasts longer than your sickness or you feel sudden, strong pain. You may have an ear infection that needs treatment. Colds often start with a sore throat. Colds often start with a sore throat. August 15th. This early symptom tends to last for 1 to 2 days. A runny and stuffy nose is also common. Sore throats come with the flu, too. But if you have it, you'll probably be tired and have other symptoms that come on all at once. Stuffy nose may mean a cold. Stuffy nose may mean a cold. September 15th. Unless you're also feverish, very achy, and just plain zapped of energy, you likely have a cold, although many people with the flu also say they have a stuffy nose and sneezing. Both colds and the flu can lead to sinus infections. In addition to thick yellow or green nasal discharge, sinus infections can cause headaches and pain in the forehead, cheeks, and nasal bridge. The pain usually gets worse with sudden head movement or strain. Sometimes, you can get a secondary bacterial infection that needs antibiotic treatment. Flu swab tests can ID flu fast. Flu swab tests can ID flu fast. October 15th. The quickest and best way to know which illness you have is to get a test at your doctor's office. By taking a nasal or throat swab, your doctor can often tell if you have the flu virus, usually within 30 minutes or less. If the test shows you have the flu and your symptoms started within the last 48 hours, your doctor may suggest antiviral medicine to help you recover faster. Related. Flu, start antiviral drugs ASAP. Flu, start antiviral drugs ASAP. November 15th. These medications can make you feel better and shorten your illness by 1 to 2 days, especially if you start them within 2 days of getting sick. Over-the-counter products can also lessen some symptoms like a cough and congestion. Read labels and instructions carefully so you understand what the meds do and how to take them. Colds, OTC drugs can ease symptoms. December 15th. Drugstore medicines like decongestants, cough suppressants, and antihistamines can help congestion, coughing, and nasal symptoms. Acetaminophen, ibuprofen, or naproxen can treat pain or a headache. Read the active ingredients and warnings on all product labels. Many cough and cold medicines have the same ingredients, so you could accidentally overdose unless you're careful. Don't give aspirin to a child under 18. Using it to treat the flu has been linked to a condition called Reye's syndrome in kids. Hand washing is key. Hand washing is key. 13/15. Wash your hands well so you don't spread the flu to other people. Use soap and warm water. Rub your hands together for 20 seconds. Don't forget the areas between your fingers and around your nails. Rinse and dry thoroughly. Alcohol-based hand sanitizers also work. Wash often during cold and flu season, especially after you cough, sneeze, or blow your nose. Can't find a tissue? Sneeze or cough into your elbow instead of your hands. Get vaccinated. Get vaccinated. 14/15. Get a flu shot. It's made from proteins found on versions of last year's flu. It helps your body be ready to recognize and fight when you're exposed to the real thing. The flu vaccine can't give you the flu. The flu shot is very important for children older than 6 months, pregnant women, adults 50 and older, and people with long-term, chronic illnesses or weak immune systems. Some years, you can get a nasal mist version of the vaccine. Is swine flu, H1N1, still a threat? Is swine flu, H1N1, still a threat? 15/15. The swine flu pandemic officially ended in 2010. Vaccines protect against the swine and seasonal flus, which share many of the same symptoms: cough, sore throat, fever, although not everyone with the flu gets a fever, and body aches. Chicken soup. January 8. You should have some, and not just because mom says so. Studies shows it clears nasal passages and congestion better than other hot liquids. It also has an anti-inflammatory effect that may help your cold symptoms. Citrus. Citrus. February 8. You've heard it before, to avoid colds, get plenty of vitamin C. Truth is, it won't keep most of us from catching one. It may help if you're around people who get sick often, like at a daycare. But if you get a lot of it right before you notice symptoms, it may make you feel better and help you get rid of a cold faster. Oranges, lemons, limes, they're all sources of vitamin C and can be tasty, too. Germ fighters. Germ fighters. March 8. Kale, broccoli, cranberries, green tea, red onions, blueberries. What do these have in common? All have an antioxidant called quercetin that may help you fight the common cold. The research here is pretty new, but they may be onto something. Bring the heat. Bring the heat. April 8. They won't help you kick your cold, but chili peppers can clear out your nasal passages, and that can make you feel better. They have something called capsaicin, which studies show may help with your stuffy head. Ginger. Ginger. May 8. A cup of fresh, hot ginger tea may seem to be just the thing you need when you're nursing a cold. It helps clear congestion and soothe your throat. And some studies show this spicy root may help prevent the common cold by blocking the virus. Dairy. June 8. Milk, ice cream, cheese. Dairy gets a bad rap. Common wisdom says to avoid it when you're stuffy or runny because you'll make more mucus. But there's little evidence to support this. So if you crave ice cream to soothe that sore throat, go ahead and indulge. Garlic. Garlic. July 8. Scientists think garlic has some things in it that may fight the common cold. There is also some evidence that garlic may prevent colds, but more studies are still needed. Nevertheless, it's a good excuse to toss in a few extra cloves. Caffeine and alcohol. Caffeine and alcohol. August 8. You're better off avoiding these. You need lots of liquids when you have a cold, but caffeine and alcohol are no-nos because they can dry you out. Of course, if you get a raging withdrawal headache without your morning coffee, by all means, have a small cup of joe. Or try a little caffeinated tea instead. Symptoms come on fast. January 13th. When you have a cold, symptoms like a stuffy nose or sneezing start slowly and gradually get worse. Flu symptoms typically hit your body all of a sudden and they'll probably feel a lot stronger. Chills. Chills. February 13th. This is when you shiver because your body temperature changes. Chills aren't typical signs of a cold, they're an early sign of infection and high fever. They're more common with flu or pneumonia. Increase in temperature. Increase in temperature. March 13th. This is a sign that your body is trying to fight an illness or infection, but it's rarely caused by a cold. flu, bronchitis, and pneumonia are more common causes of fevers. You are considered to have a fever when your temperature reaches 100.5 F. Body aches. Body aches. April 13th. You may have some slight body aches with a cold, but stronger ones are usually a sign that you have the flu. This is because short-term achy muscles often happen along with a fever. Wheezing. Wheezing. May 13th. This is when your breathing sounds like a whistle. If you wheeze, it's a sign of a more serious infection like pneumonia or bronchitis, especially if it happens when you lie down. Wheezing also can be a sign of anaphylaxis, a severe allergic reaction to something you ate or an insect bite. Cough with mucus. June 13th. You may have a mild, pesky cough from a cold, but if you cough up mucus slimy stuff from deep down in your chest, it can be a sign of bronchitis or pneumonia, especially if there's blood in it. Fatigue. Fatigue. July 13th. Feeling like you have no energy or appetite is a typical symptom of the flu. It's less often caused by a cold. It can also be a sign of pneumonia or a sinus infection, which is common but more serious than a cold. Sore throat. Sore throat. August 13th. A mild one is a typical symptom of a cold and sometimes the flu. It should clear up once your cold or flu does. But a very painful sore throat that comes on quickly can be a sign of strep throat. That's a bacterial infection that should be treated with antibiotics. Headache. Headache. September 13th. Many things can cause this, but a cold isn't usually one of them. It's a common flu symptom and can be a sign of a sinus infection. But painful sinuses, the spaces above and around your nose, can also be caused by hay fever or rhinitis. Chest tightness or pain. Chest tightness or pain. October 13th. This is a telltale symptom of a more serious respiratory infection, like bronchitis. That can also make your chest feel tight, and you may have a hard time taking a deep breath. Sharp chest pain that feels worse when you cough can be a sign of pneumonia, and chest tightness is also a common symptom of asthma. Get medical help right away for any chest pain or pressure. It can also be the sign of life-threatening conditions such as a heart attack or a blood clot in the lung. Shortness of breath. November 13th. Colds can cause a very stuffy nose, which make breathing a little harder, but real shortness of breath is a sign of something more serious. It's a common symptom of asthma or a flare-up of COPD, and it also can be from a serious infection, like bronchitis or pneumonia. Ear, face, or eye pressure. Ear, face, or eye pressure. December 13th. If you feel pressure in your ears, it may mean you have a sinus infection. That also causes pain and pressure around your eyes, cheeks, or forehead that gets worse when you bend over. And if you feel fullness in one ear, it may be a symptom of an ear infection. Symptoms that don't go away. Symptoms that don't go away. 13/13. Flu symptoms may be bad, but they usually get better within a few days. A cold can last up to 10 days. But pneumonia symptoms can stick around up to a month or longer. And bronchitis can last several months in some cases. Call your doctor right away for any new or worsening symptom so that the right diagnosis can be made and you can get the right treatment. What are fluoroquinolones? January 10th. These antibiotics treat or prevent certain bacterial infections. You're more likely to know them by their generic or brand names. Ciprofloxacin, Cipro. Delafloxacin, Baxdela. Levofloxacin. Moxifloxacin, Avelox. Ofloxacin. Doctors prescribe these as NED, but they can cause serious side effects. You should know what to look for when taking them. Common side effects. Common side effects. February 10th. Some people who took fluoroquinolones reported nausea, diarrhea, headache, dizziness, lightheadedness, trouble sleeping, serious physical side effects. Serious physical side effects. March 10th. There is a chance that your body will respond to these antibiotics with more severe reactions, including tendinitis, tendon rupture, ruptures of the aorta, numbness or tingling, pins and needles in arms and legs, muscle weakness, muscle pain, joint swelling, irregular heartbeat, ringing or buzzing in ears, vision problems, skin rash, skin sensitivity to sunlight, serious mental side effects. Serious mental side effects. April 10th. Some people have reported emotional and psychological reactions while taking these drugs, including anxiety, depression, hallucinations, suicidal thoughts, confusion. When to look for changes. May 10th. Serious side effects can start after the first or second dose. Most people who reported them had one or more of these. Long-term pain. Problems with tendons, muscles, and joints, including swelling, pain, and tendon rupture. Symptoms that lasted longer than a year, which means they may be permanent. These side effects led to changes in quality of life such as job loss, financial problems, and increased family tension. Related. Boxed warning on medication label. Boxed warning on medication label. June 10. The FDA put its strongest warning on the drug packaging. You should know. Fluoroquinolones carry a higher chance of tendinitis and tendon rupture. It's greater for those over 60, in kidney, heart, and lung transplant recipients, and those taking steroid medications. Stop taking the fluoroquinolone at the first sign of tendon pain, swelling, or inflammation. Avoid exercise and use of the affected area, and immediately ask your doctor to switch to a non-fluoroquinolone drug. A higher incidence of ruptures or tears in the aorta has also been found with fluoroquinolones. Stop taking the medication if you have sudden severe constant pain in the stomach, chest, or back. Seek medical treatment immediately. Look for the medication guide. Look for the medication guide. 7 out of 10. Your prescription will come with FDA-approved information to help you recognize or avoid serious side effects. Here's part of the guide. Cipro registered, Cipro, ciprofloxacin hydrochloride, tablets for oral use. Read this medication guide before you start taking Cipro and each time you get a refill. There may be new information. This guide does not take the place of talking to your healthcare provider. What is the most important information I should know about Cipro? Cipro, a fluoroquinolone antibacterial medicine, can cause serious side effects. Some of these serious side effects can happen at the same time and could result in death. If you get any of the following serious side effects while you take Cipro, you should stop taking Cipro immediately and get medical help right away. Joint pain, swelling, popping sounds, or muscle weakness. Tingling and possible nerve damage. Anxiety, depression, hallucinations, suicidal thoughts, confusion. Benefits versus risks. August 10. For some types of sinusitis, chronic bronchitis, and urinary tract infections, the risks of fluoroquinolone drugs are greater than the benefits for most people. For some serious infections, like pneumonia or infections inside the abdomen, the benefits of fluoroquinolone drugs outweigh the risks. Your healthcare provider can talk to you about your best choice. What do you need to do? What do you need to do? September 10. Before you take a fluoroquinolone, read the entire medication guide to understand warnings and side effects. Stop taking Cipro and seek emergency medical help right away if you have any serious side effects after starting treatment, such as unusual joint or tendon pain, muscle weakness, a tingling or burning sensation, arm or leg numbness, pain in the abdomen, chest or back, confusion and hallucinations. Report any side effects to your healthcare professional and the FDA MedWatch program. FDA MedWatch program. FDA MedWatch program. October 10. You can report a bad side effect to the FDA in these ways. Report online. Use Consumer Reporting Form FDA 3500B. Follow the instructions, and fax or mail it in. For help filling out the form, see MedWatch Learn. Call the FDA at 800 FDA 1088, 800 332 1088, to report by telephone. Healthcare professionals, use Reporting Form FDA 3500 and these instructions. Related. Respiratory illness. January 13. The most common culprit for that rasp in your voice? An infection in your airways. A cold, the flu, bronchitis, or another upper respiratory infection can make your vocal cords swell temporarily, also known as laryngitis. Seasonal allergies. Seasonal allergies. February 13. Just like viruses, outdoor allergies to certain trees and plants in bloom can cause laryngitis. The irritation and drainage that hit your airways might also make you clear your throat more often and inflame your vocal cords. Tonsillitis. Tonsillitis. March 13. A virus or bacteria on your tonsils, the oval-shaped tissue pads at the back of your throat, causes tonsillitis and can lead to a scratchy, muffled voice. You'll likely have other symptoms like a fever, swollen tonsils that look white, yellow, or red, and a sore throat that makes it hard to swallow. Voice stress. Voice stress. April 13. When you misuse your voice, it can do temporary damage your vocal cords. It could happen if you talk loudly for a long time, shout, belt out a song at the top of your lungs, or talk in a really high or really low voice. It should get better with time, rest, and lots of water. Rheumatoid arthritis, RA. Rheumatoid arthritis, RA. May 13th. Sometimes the inflammation caused by this condition can affect a small joint in your neck near your vocal cords called the cricoarytenoid joint. If you have RA, ask your doctor about your hoarse voice, especially if you feel like there's something stuck in your throat. It could cause trouble breathing later on. Thyroid problems. June 13th. The thyroid gland sits in your neck just in front of the nerves that control your vocal cords. Problems with it that can lead to long-lasting hoarseness include hyperthyroidism, it makes too much thyroid hormone, and your body burns energy too fast; hypothyroidism, it makes too little, and your system gets too slow, or even thyroid cancer. Nerve conditions. Nerve conditions. July 13th. Diseases like multiple sclerosis, Parkinson's disease, or myasthenia gravis can cause a hoarse, raspy voice because of their effect on your vocal cord nerves. It's unlikely that voice problems would be the first and only symptom you'd have. Usually, they're just one of many other signs of these diseases. Yeast infection. Yeast infection. August 13th. Do you get chronic laryngitis? It's rare, but sometimes a fungus like those that cause yeast infections could be to blame. If you use an asthma inhaler, you might be more likely to have yeast in your vocal cords. Precancerous cells. Precancerous cells. September 13th. Abnormal cells growing on your larynx or voice box, the hollow organ that holds your vocal cords, can press on your vocal cords and keep them from working the way they should. Your larynx is lined with squamous cells, so cancerous cells go on to be squamous cell carcinomas. If you find cancer of the larynx early, it's easy to treat. Non-cancerous bumps and lumps. Non-cancerous bumps and lumps. October 13th. Growths like polyps, cysts, or nodules aren't cancerous, but they can push on vocal cords in the same way precancerous growths do. Professional singers are at high risk of getting them. They result from the constant friction of your vocal cords rubbing together, much like a blister forms on your heel when your shoe is too tight. Typically, it takes rest, therapy, or surgery to treat them. Acid reflux. November 13th. Gastroesophageal reflux disease, GERD, makes stomach acid rise up into your throat or even onto your vocal cords. Over time, this laryngopharyngeal reflux, LPR, irritates your throat tissues. Usually your hoarseness will be worse in the morning, if GERD is the cause. You may not have any heartburn at all when you have LPR. Smoking. Smoking. December 13th. Breathing in smoke, either by smoking yourself or by taking it in secondhand, can cause permanent changes to your vocal cords over time. When they swell, the pitch of your voice could get deeper. Smoking also raises your risk of throat cancer. Medications. Medications. 13/13. Corticosteroids, the medication inside an asthma inhaler, can sometimes cause dysphonia, otherwise known as difficulty speaking. Other meds that can mess with your voice quality include antihistamines, diuretics, anticholinergics used to treat bladder problems, Parkinson's disease, or depression, and blood clot medications. Common sore throat or something else? 1/20. We all know that raw, scratchy feeling in the back of the throat. It could just be dry winter air, seasonal allergies, or a plain old cold. But it also could be a bacterial condition, like strep, or a viral infection or something else. Only your healthcare provider can tell for sure. But you can look for a few signs on your own. Take a good look. Take a good look. 2/20. Grab a flashlight, look in the mirror, and say, "Ah." You could find some important clues. You might see white dots or patches in the back of your throat. Your tonsils, the bumps on either side at the back of your throat, might be red and swollen, too. These could be signs of bacterial infection like strep throat or oral thrush, or a viral infection like oral herpes or mononucleosis. They also might be something else, like tonsil stones, which are painful calcium deposits on your throat. Do you have cold symptoms? Do you have cold symptoms? 3/20. If you have a cough and drippy nose along with your sore throat, that could be good news. You may feel crummy, but you're less likely to have a serious infection. You probably just have a common cold virus and postnasal drip. Do you have a fever? Do you have a fever? 4/20. Colds can cause a fever, but it's usually just a mild one. If you have a sore throat and a fever over 101 F, it's more likely to be a throat infection like strep than a simple cold. But these don't always raise your temperature, so watch for other symptoms. Are your lymph nodes swollen? Are your lymph nodes swollen? 5/20. The most common reason is infection, viral or bacterial. Lymph nodes trap and destroy germs, and they can swell up when they start to fight an infection. You might feel them under your jaw or on either side of your neck. But it doesn't always mean anything serious. Even the common cold can cause swollen lymph nodes. How much does it hurt? 6/20. When a cold causes your sore throat, it can be plenty painful, but it usually goes away after a couple of days. Bacterial infections, like strep throat, tend to cause more severe pain that doesn't get better. With strep, it may hurt so much that you can barely swallow. Sometimes, it can cause nausea, loss of appetite, headaches, or stomach pain as well. Is there a rash? Is there a rash? 7/20. A rash on your neck and chest that sometimes spreads to the rest of your body can be a sign of a group of bacterial infections called streptococcal infections. The most minor of these is strep throat, but they also include more serious ones, like scarlet fever, bacteremia, bacteria in the blood, and toxic shock syndrome. They all need to be treated by a doctor, usually with antibiotics, as soon as possible. Bacterial infections. Bacterial infections. 8/20. They may feel the same, but a common sore throat and bacterial infections are very different. Most sore throats are caused by viruses, like the cold virus. No medication will cure a cold virus, you have to let your body heal on its own. But antibiotics can fight a bacterial infection, such as strep, and stop it from spreading. Colds and antibiotics, just say no. Colds and antibiotics, just say no. 9/20. If you have a sore throat from a cold, antibiotics won't help at all. They only help against bacteria, not viruses. Taking antibiotics when you don't really need them has a risk, too. Too much exposure to antibiotics can turn regular bacteria into super bugs that don't respond to treatment. Rapid strep test. Rapid strep test. October 20th. To figure out if strep, the most common bacterial throat infection, is causing your sore throat, your doctor may use a rapid strep test. Results are ready in 5 to 10 minutes, but the test doesn't pick up all cases of strep. If yours is negative, your doctor may send a throat culture to the lab to be sure. That's more thorough, but you won't get the results for a few days. Related. Antibiotics for strep. Antibiotics for strep. November 20th. If you do have a positive strep test, your doctor will give you oral antibiotics. You'll probably feel better in a day or two, but don't stop taking the medication. Finish the whole course, which is usually 10 days. If you stop too soon, some of the bacteria could survive and get you sick again. You'll still be contagious up to 24 hours after you start antibiotics, so wash your hands often to protect people around you. And throw away your toothbrush. Home care for sore throats. 12/20. No matter the reason for your sore throat, simple home remedies can make you feel better. One thing that might work is a saltwater gargle. Just mix half a teaspoon of salt into a glass of water, then gargle, and spit it out. It can keep your throat moist, help with swelling, and ease that raw, scratchy feeling. Humidifier or vaporizer. Humidifier or vaporizer. 13/20. Steam from a humidifier or vaporizer can keep your scratchy throat moist and cut down on pain. You can also lean over a sink with hot running water. Drape a towel over your head to trap the steam, and breathe deeply. Try this for 5 to 10 minutes several times a day. Warm compress. Warm compress. 14/20. Try a warm water bottle or heating pad against the outside of your throat. Or wet a towel with hot water to make your own warm compress. It can help soothe tender lymph nodes in your neck. Soothing foods. Soothing foods. 15/20. If you need an excuse to eat ice cream, a sore throat is a great one. The cold has a numbing effect, and the creamy texture makes it easy to swallow. Other soothing foods include milkshakes, gelatin, and hot soup. If your sore throat is especially painful, stay away from crunchy or spicy foods. Related. Hydration. Hydration. 16/20. If you have a fever and don't drink enough fluids because it hurts to swallow, it can make you dehydrated. Choose drinks that are easy on your throat. Water and warm tea are good choices. Stay away from citrus drinks, though, because they may sting your sore throat. Pain relievers. Pain relievers. 17/20. Over-the-counter medicines like acetaminophen, ibuprofen, or naproxen can help dull the pain of a sore throat. But be careful if you're taking something for a cold or the flu. Some of those medications already include a painkiller. You don't want to take a double dose. Sore throat sprays and lozenges. Sore throat sprays and lozenges. 18/20. You can soothe a painful sore throat with a numbing spray or lozenge. But don't give lozenges to small children. Carry a travel-size throat spray in your purse or briefcase for relief on the go. Sucking on ice chips can also bring some relief. Decongestants. 19/20. If you have a cold and fluid draining from your nose irritates your throat, you could try a decongestant nasal spray or oral decongestant. They help dry up post-nasal drip and give your throat some relief. Just follow the directions and don't take them longer than recommended. If you use any other regular medications or have high blood pressure or heart problems, check with your doctor first. Lingering sore throat. Lingering sore throat. 20/20. If it lasts longer than a week or gets worse, check with your doctor, even if you had a negative strep test. A throat swab may miss bacteria, so you may need another one. A sore throat that doesn't go away could also be a sign of acid reflux, mononucleosis, or another condition.